A collaborative project between the Markup and Mozilla Rally called Pixel Hunt discovered that metapixel installed on the websites of several health systems sent personal health information of real patients to Facebook. The shared data included the patient's names, medications, allergic reactions, and details of doctor appointments. The investigation found that 33 hospitals with more than 26 million patient admissions and outpatient visits in the year 2020 sent appointment details to Facebook, but the actual extent of the data sharing may be far greater, as the investigation was limited to just over 100 hospitals, instead of every single hospital nationwide. Former regulators, health data security experts, and privacy advocates believe that the hospitals in question may have violated the Federal Health Insurance Portability and Accountability Act, also known as HIPAA, which prohibits the sharing of personally identifiable health information without the individual's consent or by passing specific contracts put in place. Neither the hospitals nor Meta has confirmed to having such contracts, and no evidence was found to indicate that the patient's consent was obtained. After the investigation, Fried Dirt Hospital removed the metapixel from its website, and 6 other hospitals also removed pixels from their appointment booking pages. At least 5 of the 7 health systems with metapixels in their patient portals also took them down. Though Facebook is not subject to HIPAA, experts are concerned about how the company might use the personal health data for profit. The markup couldn't determine whether Facebook used the data for targeted advertisements, recommendation algorithms, or other profit-generating purposes. So what is the metapixel that I keep talking about anyway? The metapixel, previously known as the Facebook pixel, is a piece of JavaScript code that website owners can embed on their sites to track user behavior, gather data, and measure the effectiveness of their marketing campaigns. The pixel allows businesses to understand how users interact with their websites. This is normally in the context of web stores, seeing how customers are viewing products, adding items to carts, and whether or not they're completing a purchase. The metapixel works by collecting data on user interactions such as clicks, page views, and other activities, and then sending this information back to Meta, formerly known as Facebook, for analysis. This data can be used by businesses to optimize their marketing strategies and target their ads more effectively based on the behaviors and preferences of the users who visit their websites. Additionally, the metapixel enables businesses to create custom audiences for their advertising campaigns, retargeting users who have previously interacted with their websites and showing them relevant ads on Meta's platforms like Facebook and Instagram. By doing so, the pixel helps businesses improve their returns on investments for their advertising efforts. However, the metapixel has also been a subject of controversy due to privacy concerns, as it can potentially collect sensitive information about the users, such as their browsing history and personal data, without their explicit consent, as seen in the case of the health systems mentioned earlier. The pixel has the potential to collect and share sensitive health information, potentially violating privacy laws and raising ethical concerns. During the Pixel Hunt project, a participant using the MyChart portal for Novant Health, a North Carolina-based health system, discovered that the metapixel shared sensitive information with Facebook, including the type of allergic reactions the patient had to specific medication. The markup revealed that the metapixel collecting and sharing other sensitive information, such as the name and dosage of the medication in the health record, any related notes, and the user's response to a question about sexual orientation. Experts raised concerns that sharing sensitive health data with Facebook may damage the patient's trust in an increasingly digitalized health system. Facebook can infer intimate details about people's health conditions through other means, but the data collected by pixels on the hospital's websites is far more direct. Facebook's data collection on hospital websites has led to class action lawsuits in several states with mixed results. In 2019, a class action lawsuit was filed against a Massachusetts-based Partners healthcare system, now known as Mass General Brigham, accusing the system of violating patients' privacies and its policies by installing the metapixel and other tracking tools on its websites. Health privacy consultant David Holtzman stated that any individually identifiable health information provided during the appointment request process is protected under HIPAA and cannot be shared with third parties like Facebook. Ilana Peters, a privacy lawyer and former head of HIPAA enforcement for the Office of Civil Rights, noted that HIPAA-covered entities should not share identifiable information with social media companies unless they have authorization from the individual and consent under state law. Patients have the right to file HIPAA complaints with their medical providers, who are required to investigate these complaints. Most of the hospitals contacted by the markup didn't respond to the questions or explain why they hadn't saw the metapixels on their websites. Privacy advocates argue that the online advertising industry's inability to police itself is evidenced by the use of trackers such as the metapixel on hospital websites. Alan Butler, the executive director of the Electronic Privacy Information Center, criticized Facebook's system for creating code that snoops on users before proceeding to claim plausible deniability. In light of these alarming findings regarding Facebook's metapixels on hospital websites, it is evident that patient privacy is under threat and healthcare providers must take immediate action to mitigate the risk. The potential for HIPAA violations, as well as the erosion of trust between patients and healthcare providers, underscores the importance of ensuring that personal data remains secure. Furthermore, this incident serves as a stark reminder on the need for increased scrutiny and regulation of the online advertising industry in order to safeguard the privacy of individuals and uphold the trust that we place in our healthcare providers.